I'd just like to welcome you and thank you so much for spending your morning teaching for the GCRN. In case everyone is not familiar, Francine van Broekhoven is a worldwide expert in medical thermography. I understand you're the president of the Institute for the Advancement of Medical Thermography. You are a teacher, you're a trainer, a thermographer yourself, and we're just so excited to have you with us to share your expertise. Thank you so much for being here.
Well, thank you so much for having me. It's really an honor to talk about medical thermography to paramedics, medical doctors, and naturopaths. So this is a great opportunity. And excuse me for my language, because my native language is Dutch. I live in the Netherlands. And I want to introduce myself just really quickly because we're going in this hour in depth in medical thermography. So you have a basic understanding of what it is. I started out with my practice as a doctor of Oriental medicine. I studied acupuncture and I had my practice for years. My mother was a naturopath and we were really buddies. We shared so many knowledge. And in 2008, she got breast cancer. And, we were so surprised. We thought, why don't we know anything about breasts? Maybe you can relate to that you never thought about breasts. But we saw it as a part of the whole body. So we thought, what are we going to do? Well, she got to the hospital. Long story short, she died in 2012 on the consequences. And I lost my body and had so much grief. And I thought, what could we have done? What is the prevention? What can women do? Or what can we tell them to do? And so I was looking on the internet. I couldn't find anything about prevention. So that was one thing that could make a difference. And I thought that was medical thermography. So I stopped my practice acupuncture, went to the States, got my license for a medical thermographer. And I got back to the Netherlands. And so I've been doing medical thermography now for about 7 years. And I was so enthusiastic about it. Meanwhile, I did about 6,000 studies, not just breast, but also full body studies. Also men come in, but I will tell about that later. So that's how I got so much knowledge about what is medical thermography and what is it not, because it's being compared so many times to the hospital examinations, but it's so different. And I will tell you all about it. So how does it work? Let's start from there. So this is a lady sitting in front of the camera. And, that's the one thing. If a person comes in, needs to cool down for 10 minutes, and then we can start making the images. I have my camera right here. And I just want to show you because you can see it over there too. But you see my camera here. It has a lens made of germanium. And this is a FLIR camera. This camera has the highest resolution in its kind. And we're not measuring the temperature, but we're capturing the emissivity coming from a living creature. So it's for humans, but also for animals. And but anyway, how does it work? Well, you all know Hippocrates, the very well-known doctor who lived ages before AC. And so what he did, he put mud on the skin. And where the mud dried the first, it was hotter there. And there he would find the reason for some kind of illness. So that was already some kind of thermography. And so we don't have to use the mud anymore. We've got this beautiful camera. But what are we looking at? The difference is that medical doctors are trained in anatomy, physiology, and pathology. But during their work, they only use anatomy and pathology. So they know how the body works, but they can't see where it deviates from normal. And so that's what we do with medical tomography. In 1896, X-ray was invented, and that was mind-blowing. I mean, we learned so many things about anatomy because of X-ray. But still, there were doctors then who said, I'm not going to trust those images. I will cut it open myself. So it took ages, maybe decennia, for doctors to really rely on these X-ray images. And now we can't imagine doing without. So we have X-ray, we have MRI, we have CT scans, we have ultrasound, all kinds of imaging techniques. But now this new technique, medical tomography, is entering the medical world. It's not a new technique. It's being invented since 1950s. But as you know, there were no good cameras. There was no software, no laptops, nothing. So we can work with it now for about 20 years. So what we are looking at is physiology. And I want to explain that by the 6 phases of disease of Dr. Eckerich. If we have the 6 phases of disease, the first phase is some muscle ache or a cough, whatever, it will pass and get back to normal. But if you have an inflammation going on, or if you have diarrhea, that's the second phase. But mammography, if we're looking at mammography, it can only see something with the X-ray when tissue changes have already occurred. So they're really looking for a lump that's already there. That's why mammography is never preventative, because they can't see anything else. They can't see an inflammation. So if you look at the 6 phases of disease, mammography, it's in phase 4. And me, as a medical tomography, I'm very curious, what was happening before it occurred? What was happening before the lump got there? So with medical tomography, we are looking at phase 2. We also see other phases, of course, but we have a possibility to look at the changing of the physiology from phase 2 and up. And, the body works on keeping balance in temperatures. It always does that. So the most important thing, what we are looking at with medical tomography, is asymmetry. If there's an asymmetry in temperatures, that's strange, We think, what's going on here? So if you have the breasts, and both of the breasts didn't have any surgery or whatever. So, but if one breast is really cool and the other has a hot spot, then you think, why is this hot spot there? And women don't have to feel this, they have no idea. But the camera is so precise and so has such a high definition that we determine it immediately. So that's when we want to start investigating more, do more examinations, and preferably with ultrasound. And women now here in the Netherlands are being called to have their mammogram when they're 50 years and up. But I say, no, we need to do something different, not as a change, not to substitute mammography, but to do something really different. And I think women from 30 years and up should have a thermogram with an ultrasound. So they have the physiology and they have the anatomy together in a very safe way examined. And then we see, okay, what kind of level of concern is going on here? Because, breast cancer is really dangerous for women around their 40s. So anyway, what are we looking at? I take sometimes some rabbit holes, sorry. So we're looking at asymmetry in temperatures. That's really important. What we also see is very superficial blood levels, like varicose veins. And sometimes we also see those blood veins on the breast. Unusual places on the body can be hyper or hypothermic, so really cold or really hot, where it's not normal to have those temperatures there. And if we take away all the colors, we're looking at a grayscale. We have all kinds of palettes. I will show you later on. So if you're looking at this palette, the grayscale, that's an image taking off the back of a woman. And you see all this mottling pattern. Can you see that? That mottling pattern should not be there. This is really a sign of a hormonal disturbance. So she needs to address that. Then on the other side, you see the feet. This lady, she broke her feet and she was a medical tomographer. And she said, I'm really curious what my feet looks like now. So she broke her left feet and you see the inflammation coming up there. But the other feet is sympathetically cooling down. That's so beautiful that we can actually see that with medical tomography happen. So it doesn't stay green, but it gives the blood to the other feet to help the other feet. Beautiful response. So sometimes we have those cold spots, usually or a lot of times on the abdomen, as you can see here. And sometimes people say, oh, that's fat, that's cold, but that's not the case. Our brains, our nervous system know what's going on in the body and it wants to heal. And it does that by giving signals to the tissue or to the organs. And so if a signal comes from your nervous system that tells we need to heal the small intestine because there's a leaky gut or there's inflammations going on, what it does, it sends a signal, but it wants also to send extra blood to the small intestine. And where does this blood come from? Exactly, from the skin. So that's why we get this cold spot. So sometimes people say, oh, a hot spot, that should be an inflammation. But it really takes a bit more knowledge about medical tomography to really understand why this cold spot is here. So this cold spot is here on the anatomical region of the small intestine because there's an inflammation. So having said that, we can see all kinds of things. And we sometimes say, we see it before you feel it. If people come in for a full body examination, sometimes we see asymmetry behind the ears in temperatures. That could mean that the atlas has a subluxation or something other in the posterior neck going on in the spine. You can also see the asymmetry here between the one and the other breast, being the left breast being very cold and the right breast being warmer. Also, mottling pattern over the stomach, a hand completely red, which should be blue, means maybe diabetes or high blood pressure. We can see so many things, and that's the beauty of it. Because we can give them the client their report, the thermogram, and in this report we describe all these patterns. We say, okay, this points out to be this and this. Have it investigated, or go see your chiropractor, or go see your naturopath, and do something about it before it really gets a problem. So I always give an advice to women who come in for their first thermogram for the breast. I say, if you come in for the first time, please have a woman's health screening. A woman's health screening means we do the whole head, the neck, posterior, and the anterior view, the whole abdomen, of course, the whole breast, and the whole back. The reason why we want to do this in the first time is that breasts often not just become sick out of themselves. It usually comes from somewhere else, sometimes from inflammations in the jaw. Let me see if I have, like this. You see, here are inflammations in the jaw, and people don't even know it. And the dentist with their x-ray can't see the inflammations, but you see it draining down, and we often see that draining down towards the breast. So a breast can have a higher level of concern because of the drainage patterns coming from the inflammation in the mouth. Also, a crooked spine, inflammations in the gut, or you see a dropped shoulder here on the left side. There are so many things that can relate to being the breast getting sick or getting complaints, getting pain. And one of the most important things is, of course, the bra, because that will really create a stagnation of the free flow of lymph. We have a lot of lymph fluid in our body, much more than blood. But women tend to store their toxins in fatty tissue where it's safe. And the breasts are outside of the body and it's completely safe. It's not a vital organ. So women keep a lot of toxins in their breast. If they don't know it, then they have no idea what's going on. So that's why, apart from apart from the medical thermography, we also give a lot of tips for what women can do to keep their breast healthy. I will show you a bit more later on. So this is a nice image from the mouth where people can take these images to their dentist or to a holistic dentist who say, okay, I'm going to take this serious. We need to address this. And then you can make before and after images. Isn't that beautiful? So, but let's talk a little bit about breast exams. We have mammography, we have ultrasound, MRI, self-examination, and thermography. And sometimes women think, that thermography is a way of cancer screening, which is absolutely not, because we're not looking at phase 4 to see if a lump is already there. We are looking at what is the asymmetry, what is the level of concern, what can you do to bring this level of concern down and have two beautiful breasts that are symmetrical. The image here, both breasts are a bit blue. They're cooled down because she has been cooled down for 10 minutes. And you see they're perfectly symmetrical. So this woman, she has a low level of concern of her breast. But if we see all kinds of patterns, she needs to address that and then come back in 3 to 6 months. And if we have a low level of concern, then leave it for a year, 1.5 years. Younger women, we say leave it for 2, 3 years. We also like to give women all these tips because the anxiety around breast cancer is enormous. And if a woman turns 50, here in the Netherlands, if she gets this letter from the government to have a mammogram, she's just frightened. And I get women in my consultancies that are just frightened. They don't even dare to touch their own breasts. So if I ask them, do you self-breast examine? They say, no, I will not touch it. Maybe my husband wants to do it, but I'm not touching it. I mean, what kind of an era have we entered that women not even dare to touch their own breasts anymore? So I also teach them how to do a good breast examination. And it's all about asymmetry in breast examination. So what we learn from the internet is to do it like this, asymmetrical, look for a lump. That's not what it's about. You should do it with both hands and look for asymmetry. Sometimes it's a little string or a hard place or a plate or whatever. And if you feel that asymmetry, then it's time to see a doctor. So, this is a nice example of how the lymph is flowing around the breast. There's so many lymph fluid here. And so this is just a nice way to show women what they can do. Also dry brushing, we have a lot of videos nowadays of dry brushing. This is the dry brush. It's really a simple brush. It comes from the Ayurvedic, and you just brush your skin very gently. And if you do that every day, we see lots of improvement. So improvements, I mean, in the sense of the thermograms. So if we have these different palettes, we get different information. What you see here is that both breasts are typically blue, completely on the left side. And she has fairly low level of concern because it's symmetrical, but there still are a lot of patterns. And these patterns, she can address that with dry brushing, taking off the bra, having a free flow of lymph because the toxins need to get out of the breast. In the Netherlands, we also have breast tissue treatment therapy, and there is a school here who are able to teach these breast tissue treatments, and it's so helpful. So it's not just for the tissue, but it's also for traumas. So if women have gone through breast cancer or any other thing like biopsies and they don't trust it anymore, they can get this breast tissue treatment, which gives a lot of improvement in the breast. What you see is a lot of vascularity in the middle. This is the Grayscale again, and in Grayscale we can see how the vascularity is running over the breast. And also this vascularity can improve. So with follow-up examinations with thermography, those vascularity can be diminished, can be less. Yeah. So we talked about beautiful symmetry. We talked about here, we also have a symmetry, but with a lot of patterns, so she needs to address that. But this is really asymmetry. So this lady had this asymmetry, very high level of concern. So we sent her off to the doctors, and apparently she had the PTIS here going on. Don't know what stage or whatever, that's up to her physician to have a look at it. And this is how it can look. So this looks like a high level of concern. And so we will not give her any tips about dry brushing or breast tissue treatment. She needs to see her doctor first. Now a little bit about the improvement. I mean, this lady came in for her first study, and she was having pain in her breast for about 5 years. And every year she went to her house doctor, and he said, well, I don't know what the pain, what it's causing, but you will get a mammogram, even if she was, I think, under 40. And so she had dense breast tissue, and they couldn't see anything with mammography because it's all white, and what they're looking for with mammography is a lump. A lump is also white. That's looking for a snowball in a snowstorm. It's so very difficult to find anything for young women under 50. So she would have a mammogram every year, very painful because she had lumpy breast. And finally she said, this is not helping me. I will get a mammogram every year, but I just don't know what to do about this painful breast. When she came in, I said, you have a beautiful symmetry, but there are a lot of patterns. So there's room for improvement here. So take off your bra, start dry brushing, have a breast tissue treatment, maybe change your diet, look at the diet. Are there any inflammations going on in the mouth? All those kinds of things. But she really did only 2 or 3 things. She took off the bra and started dry brushing. And then she called me after 2 weeks. She said, pain is gone. I said, isn't it just beautiful? So it was just a stagnation of lymph. And she had no idea because she said, I always wear these underwire bra, but they stagnate the lymph on the side of the breast. And so beautiful improvement. And you can see this improvement with medical tomography. And that's also nice for naturopaths who have clients coming in, of patients coming in with a thermogram, and they can add it to their treatment plan. And then say, okay, I see this crooked spine, you have a dropped left shoulder or an elevated right hip, what you can see here. There are inflammations going on in the lumbar spine, you see all these things. And if you can work on that as a naturopath, as a chiropractor or whatever, then you can send them back to the tomographer in about 6 months, 9 months, or maybe a year, and then see if it improves. Because you want the inflammations to be gone. So if we look at the plantar side of the feet, we get lots of information. This is really a sign of an altered gait. So, but what you can, because if someone has a subluxation in the spine or elevated hip or whatever, and he's walking to have less pain, then something happens with the feet. So yeah, this is what we see. But what we also see with the plantar side of the feet is diabetic ulcers. So for people with diabetes, it's very useful to have an image, a medical tomography image of the plantar side of the feet to see if there are any inflammations there, because they are told that they need to feel themselves on the plantar side of the feet. But sometimes it's very warm outside, or you're warm yourself, or you're very cold. It's never really precise. And with medical tomography, we measure the temperature on every pixel, which is 300,000 pixels with this camera I have. So we get it very precise. And then you can say, okay, I need to see some people who can help me with special insoles for my shoes so that I don't get an ulcer. Also, these images on the side, this man has an elevated hip and should address his spine, should see his chiropractor or whatever. Yeah. This man came in, 78 years old. He said he had numbness in his right arm. And when I saw these images, I turned it a bit cooler. I can play with the color sometimes. It doesn't change the temperature, but I just can play with it. And I saw this blue spot on the posterior neck on the right side. You see that? Well, this is really a sign of an impingement on the cervical spine. So I said, you need to go see an osteopath or maybe a chiropractor and have that addressed, because maybe it's not about maybe it is an impingement, because his house doctor said, well, it's maybe arthritis or something like that. You need to learn to live with it. But there's so much asymmetry going on in the posterior neck. I said, you can at least try it, and see if it improves. I talked about the hands a bit earlier. I said, okay, normal hands are on the right side. So normal hands in medical tomography have blue fingers, 10 blue fingers, and a little bit of green and a little bit of red. So this is normal. But if I see it on the other hand, on the left side, you see, we call that red gloves. And if we see red gloves, it's a sign of diabetes, or and also the hot fingernails refer to high blood pressure. I forgot to mention the colors. What does it mean? Okay, well, green is body temperature. And if we look at the sidebar, you see this sidebar with the colors. So green is body temperature. Anything up, so cooler, all the way to black is very cool. But if we go down to yellow and orange and red, it's warmer, and white is the hottest color we have. So what we see here is also an improvement. This lady, she got therapy for her feet, and she changed her diet for just 8 weeks. And then you see what kind of improvements that can give. So reflexology, that was the word what I was looking for. Reflexology for her feet and a change of diet. Isn't this beautiful? So you see the in the upper abdomen, that's the referral region of the large intestine. And you see there's inflammations going on, and also other patterns, and they're completely gone after 8 weeks. So more images. I like to show images because it really clears out what tomography is looking at. And the most beautiful thing I see is in the lower right corner. You see there's sciatica with a sympathetic response on the right hip. So the right hip is not staying green, but it turns blue because it's referring blood to the other side to help the other side. So scoliosis, crooked back, we see so many things. Also here on the thoracal spine and the lumbar spine, you see these inflammations. What you also see here is a bit of anatomic We don't see that with thermography. We don't. These are overlayers, which our physicians use, our interpreters. They use this to make a good interpretation of the study that's being made. Very interesting, this one. This is regional pain syndrome. And, these people are diagnosed so frequently with a completely false diagnosis. This lady, she fell off a horse, and she had a very painful left leg. And she got in the hospital, and she had x-rays, and they said, well, we can't find anything. You need to do physiotherapy. But the pain got worse and worse and worse. And she got in with me for a breast exam, and she told me about this pain. It was enormous. I said, do you mind if I image your legs? And she said, no, just go ahead. And I saw this. This is really a sign, the leg almost looks amputated. And this is really a sign of regional pain syndrome. So if you have any people going through this, then point them to medical tomographers. So I've talked for about half an hour, and I'm so curious if you have anything to ask me. You can also visit thegreenenurse.co.uk. There's also a lot of information. Let's have a chat. Let's see what questions there are.
Hi, good morning. Thank you so much. Just a couple of questions. When you did the diagram initially reflecting the intestine, the small intestine, and you mentioned that there was signs of inflammation, and I have worked with a thermographer before, so I know a little bit about it. So I didn't understand, because normally that would have been orange to red, but it was blue. So I was a little bit confused.
Yes.
That was one of the early slides.
Yes, I will go back to the slide.
Thank you.
Let me see. Well, you can see it also here, a bit of blue around the small intestine, right? Yeah. So what's going on here is that our nervous system, our brain actually says, okay, we need to help the small intestine. And it does that by referring blood to the small intestine. Where that extra blood is coming from, it's from the skin. So the skin starts to cool down, it starts to cool off, because the blood from the skin is going to the small intestine. That's why this spot is turning cold.
Okay, but why wouldn't that happen in other areas?
The body decides, we don't know. This is just a sign. And what you also see in this picture is that on the referral region of the liver and on the spleen, on the other hand, there are hot spots,
Yes.
There. And so the body is always prioritizing where the blood flow is going. Apparently, this is how it looks with this lady. So it can be very different.
Okay, thank you.
Yeah, thank you. Very good question.
No problem. Thank you. And then you talked about, when you were talking about breasts, you talked about giving a breast treatment and then dietary guidelines.
Yes.
So I was assuming, do you mean by the treatment, is it something like lymphatic, a deeper form of lymphatic drainage? Is that what your treatment involves?
Yes. Yeah. So it involves lymphatic treatments, but it goes deeper. So it's an osteopathic technique, actually, to free tissue. So that's what these breast tissue treatment therapists are doing. They're combining the osteopathic technique with the lymphatic drainage, and then together they create this flow inside of the breast. So it's not so lymphatic drainage is usually very superficial, very soft, but breast tissue treatment is going deep into the breast to release the toxins there.
Interesting. Yeah, because it's fascinating when you see the fibrocystic breasts on the thermography. And again, often doctors don't quite know what to do with that, but it's actually a sign of lymph congestion. which
Absolutely.
is really fascinating. So that kind of treatment would really open up. And again, working with the auxiliary and the thoracics and so forth. Excellent. Thank you. Another final question. Now, I totally respect and understand the importance of going wireless as much as possible, as in wireless bras, or nothing at all. But what would one suggest if your patient has very large breasts, because they're not necessarily going to want to go wireless free? And I know you can obviously buy bras that are wire free, but some of them can still be quite tight. And what I've also noticed is then you get a fungal-like condition underneath the breast, but no matter treating with tea trees, antimicrobials, antifungals, it's actually really hard to shift. And I was only thinking the other night before this, crikey, can I invent a bra for women so that when they sleep, that the bust is actually lifted high so that that area can have a bit of air? Or I was thinking, do we put, it's like an old technique for athlete's foot, but it's really effective, is especially if someone has to wear compression garments, and so you've got synthetics against the toes, to even put something like cotton wool between the toes will literally stop athlete's foot within a couple of days. So I was thinking, well, could you cut up an old pillowcase and strap that underneath your bra so that you have a natural agent? I'll just have to experiment on patients, but if anyone wants to jump in with that, with any more brainwaves, that would be fab.
Yeah. Well, I had this question so many times. Let me show you the bra that we advise nowadays. It is the Sloggy Zero Feel. The Sloggy Zero Feel has broad bands over the shoulder, so it's not, and it's wireless, of course, and it's completely seamless. So we say, okay, if you want to wear a bra, take the Sloggy Zero Feel, but wear it instead of 12 hours a day, because a lot of women who wear bras, wear it for 12, 14, 16 hours a day, So start wearing it shorter and decide when you want to wear it. If you go sporting, then please wear a bra. Don't worry, But if you wear it all the time and so you just don't know that the lymph is congested, that is a bad sign. So I'm not against the bra. It's just that I want women to get the knowledge what the bra is actually doing. So if they want to wear a bra, perfectly fine, but then do the dry brushing as well every day. Daily dry brushing. We have beautiful videos how to do this dry brushing. Very easy. You can't do it wrong, very easy brush. And so that's what I say to women. Please get rid of the wires, but Sloggy Zero Feel is perfect. And so, it's just wearing the bra less. That's what it's all about.
Yes, which I totally concur with. It's just when you talk about that with women with larger breasts, they sort of look at you. So it's trying to, as you said, it's that fine line of educating, giving a suitable alternative. So thank you for the Sloggy one. That's excellent. Because I've seen, certainly we've got old-fashioned stores like Marks and Spencer's, but I still look at them and think, but you've still got quite a strong band under there. And you wonder, yes, the wire is wrong and causes problems for so many reasons, including the electromagnetic field. But you still feel if one had a very tight band underneath, which sometimes what do they call, the advisors, they do suggest that. And then you think, well, that surely would block the lymphatic flow as well. So the Sloggy sounds amazing. Thank you.
You're very welcome. Thank you for your question.
No, pleasure. Thank you for the presentation. Amazing.
Thanks. Any other questions?
Hi, good morning, Francine. It's Aaliyah.
Hey, Aaliyah. How are you?
I'm very well. Thank you so much for the presentation. I really enjoyed that. It was wonderful. Obviously, as somebody who's met you and at Health Optimizing, where we do the thermograms, I'm getting quite a few of these coming through at the moment. And Lisa's directing them to me. And so one of my questions that I wanted to ask, which was actually something that a patient asked me just the other day, was with regards to thermography, is there something that stands out in the thermogram that you can see that could possibly be, leading towards a diagnosis of cancer, particularly breast cancer? I know you said, and we know biopsy is what we need to confirm that, but do you notice things in your thermograms where you would say it's highly likely or not?
Well, we work with levels of concern. So, because if we have a high level of concern, of course, she needs to see her doctor right away, have an ultrasound. Because if that's the nice thing with thermograms and ultrasound, if I say, okay, let me pull up this one. So if you see this image, there's a high level of concern on the right breast. But if you would make a mammogram, might be that they don't see anything because they don't see the inflammation, but it's so very clear for us that something's going on here. So this has really a high level of concern, but this could also be cysts, although cysts usually occur in two breasts at the same time, not just one, So this raises the concern, but we can never say, oh, this looks like cancer. But the level of concern is so high that she needs to see her doctor. And I say, okay, take the thermogram, take it with you, because a radiologist or someone who performs the ultrasound knows, okay, I need to have a look at the right breast on the medial side, because that's the hot spot. That's the main concern. So if I have an asymmetry in temperature, sometimes it's left breast at 3 o'clock, have a look at the left breast 3 o'clock with ultrasound, So sometimes mammography can say, do we see something here? Maybe left breast 3 o'clock, let's have an ultrasound. And I think, oh my gosh, we would have seen that with the thermography as well.
Yes.
So, But it doesn't have to be cancer. Could be fibroadenome. Lots of young women have fibroadenomes. Usually one breast at a time. Those are painful, but it's nothing. It will pass. It will just clear on its own during her ages. So,
Okay, thank you, Francine. I was actually going to ask Francine something with regards to these images that you've got here. Again, with somebody with, I have a few patients who've glioblastoma, the brain cancer. So do you, with regards to looking at the brain, what advice can you give us with what we see there and the benefits of having a thermogram for brain tumor patients?
The thing is, we look at the skin, so we can't look under the hair because we just can't see it. But if someone has something going on with the brain, or maybe even Alzheimer's, or we always want to do a full body study because there are more things going on why this person might have a brain tumor or something going on with the brain. And usually underlying inflammations are the cause. So it can be subluxations in the cervical spine or somewhere else in the spine, or kidney deficiencies, which also show up in some kind of way. So we're always, if I have a question like that, I always look at the whole thermogram, preferably full body, and you really have to have knowledge about physiology, pathways. What pathway is an inflammation going, or so that's knowledge about physiology and thermogram to see what's going on here, and then you can give very good information and tips on what they can do. So, but you need to have a very good interpreter,
right?
So the best interpreter, I think, well, I know someone in Canada, but also in the United States, who do these thermograms or interpreting for many, many years.
Right.
And they will do it in English. So also for Health Optimizing Clinic in London. Yeah.
Yes. Okay. Wonderful. Thank you, Francine. Thank you very
you're welcome. Yeah.
Francine, I would love to piggyback on what you were just saying there about the interpretation. Mm-hmm. One of the questions that I had, perhaps for practitioners that might be listening that have never received a thermography report before, is which elements you would like to see included in a thermography report, what practitioners can expect in terms of the information that that provides, and when perhaps to ask more questions, because we can see these images. And I think intuitively, with a knowledge of physiology, you may have an idea as to what you're looking at, but most of the time your interpretation, very much depends on the report that you're given. So if you can tell us some elements of what you think a good thermography interpretation would include, I think that could be helpful.
Yeah, absolutely. So if we're looking at a body like this, so the tomographer really needs to have a good understanding of what we're looking at, what is normal, and what is abnormal. So we can ask probing questions. So if I see an image like this, I immediately start asking questions like, did you have your spine checked, or did you have treatments of the spine? Because if we put that in the history, because a thermogram is not just making images, it's taking history as well. And so the history is really important to have a good understanding what's going on with the whole physiology. So sometimes people say to me, I had a whiplash, but 10 years ago, but still things are going on which relate to that whiplash. So does that answer your question a bit, Mara?
I was thinking more about, for naturopathic physicians or practitioners, if you recommend that your patient go have a thermography scan, they will do that. Mm-hmm. But then you are also, left with some report or interpretation that was given to the patient at the time. So as the person that suggested it, what sorts of information do I want to see in that report or in that interpretation?
Oh, yeah. So we give a description of the changing of the physiology, and you can take that as the therapist into your treatment plan. So we give a description of, we see hypothermia here over the right side of the body, on the back, but also on the right side of the abdomen, more than on the left. So, and it means something. It has to do with maybe liver or other things. So we describe that in the thermogram. And so the therapist can have a look at the thermogram, and the images are being interpreted already. So it's an extra information for how they want to go into a treatment with this client or patient. Does that answer your question? Maybe
it does. Thank you.
Yes. Okay.
I know. I see there's a hand up in the chat. Would you like to jump in?
Oh, yeah.
Thank you so much indeed. And thanks to the GCRN for organizing this. Francine, that was an excellent presentation. I was so delighted that you brought in not only the naturopathic, but also the osteopathic and the medical elements, of all which I practice. I wanted to ask two parts to a question, if I may. The first area was to do with, going back to traditional naturopathy. We all know that women have been made to use aluminium-based deodorants due to societal marketing. And have you seen perhaps before and after in terms of images for the use of aluminium deodorants, and when people stop using them, please?
Yes. Oh, yes. Very clear. I mean, the armpits, the axillae, can be very hot, very hypothermic when people still using aluminium in their deodorants. And so if they stop it, then there's a better flow of lymph in the axilla because they got rid of the toxins. So we see an enormous improvement there. Very clear. Yeah. So sometimes it's even white hot. Yeah.
Yeah. That's really, really helpful. And I find often to use as a as a patient education tool. That's brilliant. And if I may, just a secondary and in a way related question is, talking of toxins and where they build up in the lymphatic channels, I get a bit concerned, with these fast weight loss diets, programs, certain supplements or shakes or powders, whatever, where individuals are sold these items and often under very little professional supervision or guidance. And suddenly all these toxins that, as you correctly said, had been safely stored away in the fat are released. And yes, people are told to drink water and to flush out the system, but there is nothing else done. Sadly, as a medical doctor, I have seen people who, having lost a beautiful amount of weight and feeling really good and healthy, 6 months down the line, 1 year down the line, suddenly are diagnosed with cancer. And they wonder and they ask themselves the question, why me? I was becoming so healthy, et cetera, et cetera. And any suggestions there from your experience, please, Francine?
Yes, absolutely. Absolutely. This is what we see a lot of time. That's why I emphasize on doing a health body check. So a full body for the first time, because what we see is we see some kind of an overflow in the lymphatics if the body is not able to get rid of all the toxins. So if there's an imbalance in microbiome in the gut, or the whole intestine tract is not functioning well and not able to get rid of all the toxins, then it will overflow in the lymphatics. And that's what we see here in this image. So the whole body, although it appears she has a nice weight, still there's an overflow of toxins in the lymphatics. And so that is a very clear view for a thermographer to see this body is just toxic, doesn't know what to do with the toxins. And if the intestines, the kidney, the bladder is not able to detoxify it in an orderly manner, then it will overflow in the lymphatics. So that's what we see.
Gosh, Francine, this is really, really informative, and it also further confirms, my worries about, as I said, non-medically supervised weight loss programs. When I say medically or non-practitioner supervised, because people have different methylation rates, people have different ways of detoxification, and surely, this is very informative. Thank you so much.
You're very welcome. What we also give as an advice in the reports, the thermography reports, always start with the gut health, to heal the gut, no leaky gut anymore. Maybe Hulda Clark with the clovers and the absinthe and everything. So the gut really needs to be able to get rid of the toxins instead of overflowing it in the lymphatics. Yeah, even before doing liver flushing or whatever. Yeah. But you know all about it as a medical doctor. Yeah.
Well, I'm a naturopath at heart, so there we go.
Oh, yeah.
I'm a doctor and an osteopath, but yes, the naturopathy is the core. Thank you so much again. Really, really.
Very welcome. Any other questions?
Hi, it's Jennifer here again, just jumping on. I totally agree with what you said, Dr. Mina. And in fact, I wrote a detoxification book that Dorling Kindersley asked me to write 20 years ago. And I remember thinking at the time, golly, this is really difficult because I don't want people to charge onto a fast or do a mono diet, which actually in this day and age is totally inappropriate. So I sort of started a system, and I'm actually rewriting the book at the moment for publishing again. But I did a very, very slow detoxification program that people would do at their own level. There were certain signs that they knew when to move on. But actually, I started initially with supporting adrenal energy and digestion, sort of more upper digestion, and even the awareness of chewing food, possibly food combining. And there's lots of different things like that, because then even that would begin to lower some of the complications that can go on with SIFO, SIBO, and then the large intestine. Then I would move on to the large intestine, the lymph, the lungs, the breathing, and so forth. And then the final stage, you go into the deeper organs. But it's like a relay race where you have to prepare the body. And as Dr. Mina said, if you've got someone with SNPs, with methylation, glucuronation, and sulfuration, you have to be incredibly careful how you take that person through a detoxification program.
Yeah. And we also have a lot of women coming in with breast implants. I always say never have a mammogram if you have breast implants, because the pressure is so dangerous for women with breast implants. And we have a special breast explant surgeon here in the Netherlands. She does only explants. And because these women are so toxic, and every time it's the same over and over again, you see an overflow of all the toxins in the lymphatics. Yeah.
Thank you so much for carrying us through your wonderful presentation. Would you mind again, I think in the beginning, there's a slide with your contact information that we could maybe end with in case people have any specific questions. I know you've also authored a couple of breast health books. So I'd just like to direct everyone that is interested, both in the live presentation and folks watching the recording, to go to Francine's website, thegreenenurse.co.uk, for any additional resources. Is there anything you'd like to add to that, Francine?
If you have any question left, please give me an email on this website. You can see the contact form. So I would love to answer all your questions that are still left out.
All right.
And if you're looking for a medical tomographer, just ask me. There are medical tomographies in the rest of the Europe, in America. That's why I'm also the president of the International Association. We have a locator tool. So if you go to the locator tool, you can find medical tomographers all over the world. Yeah. Well,
that's wonderful. Thank you so much for sharing your expertise with us.
It was a real pleasure.